Our first guest this week is Mr. Scott Boruff. He's the CEO of Healthcare Integrated Technologies Incorporated. HITC is their stock symbol. Scott, good to have you back on the program.
Hey, Don, thanks for great to be here again.
Well, tell us again what the company does. It's been a while since we had you on.
Yeah, thanks, Don. Actually, Healthcare Integrated Technology is a AI technology fall detection company. So we have created fall detection for the assisted living communities and the independent living communities and memory care. What's typically out there that you see in the space is you've seen the help I'm falling, I can't get up, push a button, wear a watch, wear a lanyard. Ours is totally ambient. So it's literally AI technology that sits in the room and watches the resident. And if it falls, it sends a video clip of the fall and a text within 2 seconds. So it's been exciting.
So it's 24/7 monitoring?
24/7 monitoring in the independent living and assisted and memory care facilities. And we're rolling out the at-home version as well, because people, as you know, are wanting to stay in their houses longer. And so that's been a need that's been addressed, and we're rolling that out. Actually, we're rolling that out in the UK. We've had a UK client call that has 20,000 clients. They're a little bit behind the times over there, and all they have is the older technology. And so to be able to give them this product, they're loving it.
Well, it's remarkable because the previous technology, it was required of the senior, the person who fell down, to notify that it happened.
Yeah, and what we found a lot of times, Don, is by being in these facilities for the last 3 months, is the residents are falling. And sometimes, if you're in an independent living or assisted care and they come in there and you're on the ground, but you have to go to the ER. So what we've been able to do is look at the fall, address the fall, see if they've hit their head or anything. And if they've not, then they can just stay right there. And which brings me to another partnership that we've created since we've last talked. So we have entered into a partnership with Serbia Rehab. They're in 3 different states. They're in Tennessee, Georgia, and North Carolina. And what they will be doing is be addressing falls within the facilities that we're in. So we're bringing them to our facilities, and they're bringing us to their facilities. So it's going to be a good little partnership for us and for our clients and their clients.
I know you've done some initial installations. How's the feedback so far from the facilities?
Yeah, feedback has been great. A few of the ladies want to know if the camera could listen, and we asked them why would they want it to listen. They said, well, because in some of the facilities where the staff is overworked and they're short on staff, if they yell out, help, or want to talk, want to get up out of their bed, our camera will listen to them and send an alert that room 101 wants out of bed versus pushing a button.
Well, how does the system scan the room to determine if someone has fallen?
Yeah, so it's a 24/7, and it does gait analysis. So it's artificial intelligence. So it's actually learning the person's gait, their walk, they're in bed, out of bed, in the bathroom, out of the bathroom. And, so when they fall on the ground, that's an alert. And with that alert, out goes the text and the video.
So when you make an installation in a facility, how do you generate your revenues?
We charge $100 per month per room, and they just elect to add in or to not add in. And so far we've had everybody, want to be part of it, because it's proven fact if you have a facility and they have this technology in the room, that they're actually staying longer at the facilities, because again, with a partnership that we have with Serbia Rehab, they're actually able to study their gait analysis and determine if they're fixing to fall. So we're preventing falls, kind of predictive, which is kind of the next phase of our growth, which is being able to tell the executive director, how long they're in the room every day, how long they're in the bed every day, if they're going to the bathroom, if they're going, if they usually go to the bathroom 2 times a day and now they're going 4, that means they've probably got a urinary tract infection. So we're getting the doctors to prescribe medicines, for that. So it's been an exciting time.
How about family members? Can they monitor the status of their loved ones as well?
Yeah, they can. We are adding that model because that's been, it was about a 50-50 deal. Sometimes the facility said, hey, we're paying for it. So, we just want to, keep it in-house. But as we've rolled out 2 more facilities, the family members are wanting to be involved. If you live in Knoxville, Tennessee, and your family member's in Georgia, the family member in Georgia wants to be able to check on mom. And so that's not a problem.
Well, we had a couple of conversations before going on the air. You mentioned you're closing some deals. Tell us about that.
Yeah, so again, to be honest with you, I wasn't familiar that the hospitals had so many falls because we were just really targeting independent living, assisted care, and memory care. But we just got into a large hospital facility, had our first call last week, and we got an appointment next week with those guys, and we think we're going to sign up 9 hospitals. The one hospital we were at had 57 falls in May, and they absolutely just love this technology.
This must be a personally rewarding business to be in, knowing you're helping so many people.
Well, it's helping them, and it's helping the people, it's helping the patient, it's helping the nurse that's, like I said, it's overworked. It's it increases the nurses can do their job better, and it's kind of a win-win for everybody.
Now, when you contract with a facility, how long does the installation process take?
It takes us about 2 weeks to install it. And then once it's installed, the artificial intelligence starts learning the gates. Everybody's gate is, it's kind of like a fingerprint. Everybody's different. So we're just loading all that information into the computer system, but it works immediately. But after about 2 weeks, it's got, all that residence data loaded into the facility. And that's another option too. Like, we have the edge technology, so we keep everything there at the facility, on the facility. So it's kind of hack proof and it's HIPAA compliant.
Of course, we're finally emerging from this COVID life that we've been living. And where do you see the company going in the next 18 months? Well,
with the hospital, so there's over 1 million beds in the independent living and memory care, and there's like 996,000 hospital beds, and so we have more work for the next 6 months that we can do in Knoxville, much less in the South. So I'm in Georgia today, traveling this week to for some more facilities that wanted and heard about it down here. So I'm down here visiting some facilities that are quite large and not getting any kickbacks whatsoever.
What are you doing to protect your intellectual property, Scott?
We have filed 15 provisional patents already, and so that's nice. And we've got about 2 or 3 more that's coming in the next couple of months from the new codes that we've written over the last 90 days. So we'll have a total of 18 patents by our year end. So that's exciting as well.
Stock symbols HITC, Healthcare Integrated Technologies Incorporated. Scott, what you're doing is wonderful for people. Thanks so much for joining us.
Thanks again, Don. Have a great week, buddy.